I'm David Ruiz, and I'm a BOC certified athletic trainer. A common exercise that we use is the bird dog. Now, I was reading a recent Dan John book, and he talks about a vertical bird dog, and I thought that was a really great concept to train loading in our patients. As athletic trainers, we're often thinking stretch and strengthen, stretch and strengthen, stretch and strengthen. But what we really need to be thinking about is loading. Not just muscle hypertrophy, not just muscle elasticity, but efficiency within the motor control system, and the ability to actually activate the muscles with the right timing when we want to do that. So if we are going to look at a typical bird dog, go ahead and show us. Yes, and we see how her back collapses when she does that. And one more. And the other side. And you can see this from across the room. And if we're not correcting this, we're really not correcting the problems that we're trying to correct in our patients, especially if this is a lumbar spine patient. This is such a common exercise in lumbar spine patients, but we do it wrong so often. So let's make sure we are using our DNS principles. Let's start with base of support on the hands. Bring your hands out just a little bit wider. That's it. Good. We want to load across the hand, so PC form and base of that second, or head of that second. Spread your fingers. Good. Nice and relaxed. Bend your elbow. That's it. Spiral your shoulders. Nice. We'd like a nice, good relationship between the hips and the rib cage. Yes, good. She flattened her spine very nicely for us. We're going to elongate her spine at both the head and the sacrum. We're going to make sure she's activating here. Good. Activating low. Very nice. Breathe into my fingers. That's it. Good. Breathe wide. That's it. We're working both the breathing and the support function of the diaphragm. Good. Maintain a little pressure there and there. Very nice. Good. Elongate. Good. Now, maintaining that, let's do opposite arm, opposite leg. And we see that that improves. We still need to do a little bit more work, but we can change those with our DNS principles. But let's go ahead and stand up and let's look at a vertical bird dog. Because like I said, we really need to think about loading. So if someone has a lower extremity injury, at some point, they've got to load that ankle, that knee, that hip, the lumbar spine. And we can do this very early. We can do this in a boot, we can do this in a brace. As soon as someone who's had ACL surgery, as soon as they are weight bearing without crutches, you can certainly do this on that leg. If they're not weight bearing yet, you can do it on the non-surgical leg. You might be a little limited by their range of motion, but you can still work through that. But again, let's load this as soon as possible because they need to be able to stand, because if they can't stand, they can't walk, they can't run, they can't skip, they can't jump, they can't leap, they can't hop. So let's look at what this looks like. If this is the surgical leg, she can lift that knee and start to balance on the non-surgical leg. Again, I know some of you are saying she may not have that range of motion, and you're right, she may not be, but just work. She may not have that, but just work with what you have. We know there's going to be some neural overflow into that other side, so working the non-surgical leg as early as possible is very important. Also, we do so much to get this VMO back, but we do it in a seated position, and granted we're working at the hip end of the quad, we're still activating the quad in this. So go ahead and lift that again. Nice, and come on down. And if she's got good balance here, as she lifts, you can give a little bit of pressure there. So lift your, yes, and press against me as well. Yes, that's it, and come on down. So as she's flexing her hip, her knee is flexing, but she's also activating her VMO a little bit by pushing against my hand. That's it, push, 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 push. Yes, nice. So there's a nice variation that's in a standing position, and you're training that uninvolved side. Now, if she lifts this leg and she starts to collapse here, have poor balance on that side, you can give, very good, come on down. Give them a little bit of support here, so maintain pressure against my hand, and now do that. And as that improves, you can Do opposite arm, opposite leg in this position. Yes, good. Come on down, and now let's improve that timing with that arm and leg. Yes, very nice. We want to think about our DNS principle. She should be on all 3 points of the foot. She should be centrating that hip joint. We want to make sure there's a nice relationship between her rib cage and her hips. So bring your ribs down. That's it. Very nice. Elongate the spine. So up through into the sky. Sacrum into the ground. Activate there. Nice. Pushing against. Good. So maintain breathing and support function of the diaphragm. So give yourself some support there. Bring your ribs down. Activate here. That's it. Now go back into this exercise. So lift that leg, lift that arm. There we go. So now we're doing this in a loaded position. And once we decide that we can work the surgical side, we can switch sides and work that as well. And now when we're working both sides, we've got a daily look at their symmetry. Is the asymmetry big? Is it small? But it really gives us a sense of where we are in the rehab process. You're going to lift this side. They're having trouble activating the glute because there should be nice support the glute here. You could certainly just poke them a little bit and ask them to fire that. That's it. Good. And lift up. Nice. You can give them a little bit of a internal rotation, but fight me. That's it. That's it. Good. And you'll see that they start to activate the glute. We want to make sure that the glute is nice and round in that there's no dimpling there, and to really fire that. So it's a very nice way to also activate the glute in a pretty functional position. If you'd like to learn more about how to do this and DNS, go to www.dnsflorida.com.